Hi everyone, this is me, Danny. Just wanted to make a quick video about giving tips of how to survive nursing school if you're pre-nursing or if you're trying to get into nursing school or you are in nursing school. Just want to give some little friendly advice and tips on how to survive because the nursing school it is its own kind of beast. It's a lot different from doing like other majors. I was a biology major doing pre-med, and when I switched over to nursing it was like completely different on how to take exams, how to manage my time, what kind of classes I had to take. So it's a really difficult journey, and a lot of people tend to struggle. It all starts that you have to have good study habits and make sure you develop those early, or if you already have them, that's great. So I would say a couple of tips that I would give is that, like, number one, be organized at the very beginning. uh, have a planner, plan out your week, write down when you have exams, when assignments are due, when you have your classes, because I know in the beginning myself, it's like I'm not sure what classes I have, so I always had to have a schedule out. And then also I used a planner to plan out when I had my exams, so I would be able to plan when I should study when it came time to take my exams. So definitely having a planner and being organized is like a very key component of being successful within nursing school. Another tip I would give is like regarding readings. Sometimes having different color pencils, not color pencils, sorry, like color pens, as well as a highlighter to mark the important parts. So have like your own key for what each color represents, and then try and highlight the main parts. I know myself personally, I had a hard time highlighting just what was the most important things because I feel like everything was important, but definitely, the things that will stick out to you and that are important to know, not like little minor things. Highlight important things too that you don't understand, so they can stick out better, and like make a mark and come back to it, and then do some extra research on it or find more information about regarding that topic. Another thing I would recommend is don't procrastinate. I know that's a hard one not to do, but definitely procrastination will, nip you in the behind. It's gotten me a couple of times where it's like I could have done much better on an exam if I just studied a little bit more and didn't procrastinate. I mean, yes, nursing school is really busy, but there's like, some people take extra downtime, and I was one of those people that had extra downtime, which I should have been using more to study. So I mean, like I would spend some time on Netflix. Netflix always got me. Then I should then being studying to study my exams. So instead of getting like an A on an exam, I would get a B, and that's my own fault on that. So definitely prioritize and don't procrastinate. Try to avoid all those temptations and whatnot that derive you from doing your work and studying for those exams and preparing for clinicals as well. I think, speaking of clinicals, I'd say definitely the day before prepare for clinicals. Do your care plans early as well. Don't wait last minute to do care plans. At least for our care plans in my school, personally, they were like over 20 pages long, and sometimes they were due the night before. So I would like once I went to my clinical side and got a patient, right when I got back home, I started working on it right away because there was like so much information you had to put on there. I used the Nanda book for nursing diagnosis, and as well as other books to find like lab values, pathophysiology books as well, to help fill in those blanks. So sometimes I had a care plan due the next day when I just got the information the day before, or we were given like 2 weeks to finish a care plan, and then 2 weeks goes by fast. So definitely stay on top of your care plans. I know some people, they have shorter care plans than others, but I know other people, they've gotten more than over 20 pages. So definitely get a start on care plans right away. Don't wait last minute, because there's a lot of thinking that you have to do and a lot of information that you probably have to look up as well, and also the dreaded APA format that you have to do regarding when you look up information using different books. At least in my school, we had to always write in APA format. So there's also that for clinical. Another thing for clinical I would recommend is that always jump for every opportunity that there is, whether it's like starting an IV or putting in a Foley, passing meds, taking vitals. Always be proactive, always volunteer yourself, be the person that wants to do the skill. And I know nurses, they look forward to and they appreciate nursing students that, you know, take a step up and go beyond to like learn and like not be afraid to go in and do a task or do a skill or even ask questions. Yes, it's true, nurses are very busy, they have a lot on their plate, but if you ask like pertinent questions that are important and that are, I'm not sure how else to describe it, but that make you critically think, that are not like very basic simple questions like of information that you should know, then I know a lot of nurses appreciate that. I personally, I used to be the one that was kind of scared to want to do tasks, and I was kind of nervous. But as I went through my program, I became more proactive in my education and wanted to do more in clinical. So the nurses saw me in a better light, I would say, than just seeing me as a like a timid, nervous nursing student. And I know we all have our nerves, but it just comes with time and development. I mean, it's taking time to develop that kind of confidence, especially working with patients, and you want to provide the best care as you can. And sometimes it is nerve-wracking because you don't know how that patient's going to treat you or how they're going to be feeling that day. So there's a lot of variables involved, but definitely put your best foot forward, put your best game face on, and you're there to help a patient out, make them comfortable as they can within their stay at the hospital or at the facility or the clinic or wherever you may wind up working in the future. So don't be afraid to take that step, take the initiative of your education, and you know do what you can and learn a lot and practice is key. The more you practice your skills, the more you get better at it, and then it'd be like a piece of cake. You won't be as nervous anymore, and then you'll be able to do it on your own. You won't need like another person to come be right behind you and watching your every move, because you'll be so confident in doing it. It'll be like nothing. It'll be like a piece of cake. I think other advice I would give would be, not only like the study part about it, but also give yourself some time for self-care. Self-care is very important, and one of the things you have to look out for is burnout, because a lot of nurses, they tend to burn out because they're always working hard, they're always doing some type of work, or they're always thinking about work, and they don't think about themselves to care for themselves. So definitely self-care. Go out to a nice restaurant, go out eat somewhere with your friends, go hang out with friends, go out to the movies, go get a manicure, get your hair done, get a facial. I don't know, whatever you like to do for self-care. Read a book, watch your favorite movie or a TV show that you've been wanting to watch for the last couple of months. Take care of yourself. You have to take care of yourself first and put yourself first, or you're not going to be able to help anyone else, especially when it comes down to helping out your patients. If you're not in good shape and you're not caring for yourself, then you're not going to be able to care for others at the best of your potential. So definitely don't forget that self-care. That's very important. And again, burnout is definitely, it's a real deal. I kind of had that a little bit in nursing school where I felt very tired. I didn't really want to do much because I wasn't providing self-care for myself. So definitely squeeze that in when you can. Don't isolate yourself. Still hang out with your friends, still spend time with your families. Yes, I know nursing school takes the majority of your time in life, but you gotta try and make some time for social life as well. You can't isolate yourself, because as human beings, we tend to be very social, and we tend to like to be around other people as well. And it's good to have like those friends where you can like get your mind off of school or work or whatnot, and spend time with your family. So don't forget that as well. And the other aspect from nursing, is not just your life. You have other duties, other responsibilities, other things besides nursing. So don't forget that. The first thing is that it's you as a person. You're number one. And then all comes the rest of the other things. So don't forget that. So I think that's it for today. Thank you for watching my video. If you have any tips or or any advice for other future nursing students or people that are in nursing school, please make a comment down below. Or what are your thoughts of when you were in nursing school? What was your self-care? So you guys take care now. Have a good day, evening, night. Thank you for watching my video, and you guys take care now. And all those people within the nursing profession, you guys are doing awesome. Know you guys can do it. Yes, it is hard, but you guys will make it to the end. And know that if you have the passion for it, and you know why you're into nursing and why you chose nursing, then in the end you'll be successful. Because it takes a good nurse has to be very compassionate and wanting to help others, and that's going to be a good nurse in the end. So keep rocking on, and know you guys are wonderful and you guys can do it all. Okay, thanks guys. Bye. Thanks.